Today we are looking at drug classifications. As I told us yesterday, we have different ways we classify hard drugs. Now, today we are looking at the classification of hard drugs based on their chemical structure. Now, the reason why we look at the chemical structure of hard drugs is some drugs have similarity with others. So when somebody is addicted to hard drug, if you take a particular drug away, he can easily switch to another one that is similar to that one you took away. So there is need to study all of them based on their similarities. Now we have some drugs that we call the uppers. The uppers are those ones that when they are taken, they make somebody become very energetic and overreactive. You will see them jumping up and down, doing strange things. The young ones who say it makes them high, so to say. Now those are the ones we call the uppers. Then we have the downers. Those downers are the ones that can make somebody very calm and cool. They can calm somebody down, and that's why we call them the downers. Now, so most of the time, drugs are classified based on the impact they have on the mind and the body. Based on the impact they have on the mind and the body. So these are the ways we can classify drugs sometimes. But generally, we are going to look at, for the purpose of this study, we are going to look at classification in 3 categories. The first one is classification of drug based on the chemical makeup. And when you are talking about classification of drug based on chemical makeup, you have the alcohol, number 1 class. The alcohol, that's those drugs that are able to cause damage to the liver, central nervous system, and so on and so forth. E.g., you have beer, you have strong wine, you have liquor. Then we have those we call opioids. Opioids are drugs that are derived, they are drugs that affect the brain. They affect the brain and the neurotransmitters. So these opioids, some of them we call them heroin, we call them fentanyl, oxycodone, and so on and so forth. Then the class 3, under this classification, we have benzodiazepines. Benzodiazepines are a class of drug that function by interrupting neurotransmitters. What are neurotransmitters? Neurotransmitters are they are nerves. They are fluid that fill the nerve cavities. They fill the nerve cavities. You know, in between one nerve and another, we all have nerves all over our body. That's how the brain carry messages around the body. Now, in between one nerve and another nerve, we have what we call synaptic joints. No 2 nerves are joined together directly. They have a gap. So inside that gap, those gaps are what we call synaptic joints. And what fill in that gap that make the brain to be able to transmit its messages is what you call neurotransmitters. You know, the way brain transmits messages across the body, it does it by what we are just like an impulsive reaction. It's like electrical impulse. So when it gets to the end of a nerve, it will move through a neurotransmitter to the other nerve. So these benzodiazepines, they affect neurotransmitters such that they will nullify the neurotransmitter in those synaptic joints and fill in those synaptic joints. That's why you discover that when somebody is addicted to some particular hard drugs, before you know, gradually, it will be as if they are losing their senses, they are no longer psychologically balanced. It's because their neurotransmitters are filled gradually with some of these hard drugs, especially these benzodiazepines. Examples are what you have Valium, You have Xanax, Ativan, and so on. Then we have the cannabinoids. Cannabinoids are a class of drugs that are chemically similar to tetrahydrocannabinol. That is, their active ingredient is marijuana. So marijuana is one of those drugs under cannabinoids. They cause serious damage to a person's mental and physical health, e.g. marijuana, you have hashish, and so on and so forth. There are another class under here. We have barbiturates. Barbiturates are drugs that act on the central nervous system, slowing down its functions. They are derivatives of chemical barbituric acid. Now, normally they are used for treatment of psychiatric and sleep disorders. I told us earlier yesterday when we were doing the introduction that some of these drugs are useful. It's the abuse that make them turn to hard drugs. When you become addicted to them, they become hard drugs. Now, for example, these barbiturates now, they are used to treat psychological cases. They use them in psychiatric hospitals where they will use it to make them sleep when they cannot sleep, those people. Then at times, these barbiturates too, you can use it to calm down somebody that is just as if misbehaving. Okay? But when it becomes an addicted drug, when somebody become addicted to it, when you take it in overdose, it can shut down the whole body system. Some examples are what we call phenobarbital, amytal, and lumina. So these are drugs, classification of drugs based on their chemical makeup. Now, when you are looking at drugs classification based on effects, we can classify drugs too based on effects. And based on effect, we have depressants. Those ones are the ones we call downers, like I said earlier. Examples are alcohol, barbiturates, and so on. Then we have stimulants. Stimulants are mostly the uppers, like I explained earlier. They make somebody excited. They stimulate the system. Some of them are codeine, cocaine, and so on and so forth. Then we have the hallucinogens. Hallucinogens are drugs that alter the perception of reality. When people take it, when they abuse hallucinogens, it makes them go out of reality. Now, it's often result in somebody having hallucinations. You call it in biochemistry, you call it tripping, as if that person is no longer in the world. Somebody will say, I'm feeling high, as if I'm floating. That's the effect of hallucinogen. At times, they will be as if they are seeing strange things. Now, examples are what you call psilocybin, and so on and so forth. Then we have inhalants. These ones are the ones they inhale. They breathe them in. So most inhalants are commonly used materials that sometimes like nail polish, paint thinners, gasoline. And recently you discover that they said even some youth will go and be inhaling gas coming out of soccerways. All these ones are what you call inhalants. They are very, very dangerous and can cause serious damage to health. Then lastly, we have drugs classification based on legal definitions. When we say legal definitions, it's what we are saying is there's a schedule of drug that is legitimate because they are used for medical uses, for medicinal purposes rather. But when they are abused or when somebody gets addicted to it, then it becomes an offense. So for this one, we have the first one as those under Schedule 5. The ones that are under Schedule 5, they have some regulations and some low penalties when they are abused. So Schedule 5 drugs are legitimately accepted for medical purpose, so they have lower po ten tial for abuse. Examples are Lomotil, Motofen, and what we call Lyrica. Then we have the Schedule 4. Schedule 4 drugs, they have regulation and penalties that are in between Schedule 5 and Schedule 3. Schedule 4 drugs also are accepted legitimately for medical purpose, but when they are addicted, when they are abused or addicted to, they can cause serious health effects. So these ones are examples are Ambien, Tramadol, Tavocet, and so on and so forth. Then we have Schedule 3. Schedule 3 drugs, they have more regulation and they have very harsh penalties when they are abused. Legally, when you abuse drugs under Schedule 3, it can lead to imprisonment. Now, examples of these drugs are ketamine, Vicodin, etc. Then we have the Schedule 2. Schedule 2 drugs also have very harsh penalties when they are abused. These Schedule 2 drugs, they are supposed to be used for medical purpose legitimately, but when they are abused, then they become a risk to health. So examples of such drugs include cocaine, Ritalin, methadone, and so on. Then we have the last one, Schedule 1. Schedule 1 drugs, they have a very harsh penalty when they are abused legally. So because these Schedule 1 drugs, they don't have any legitimate acceptance. As far as law is concerned, they are not supposed to be taken. So these ones are those ones we call ecstasy, quaalus, gamma hydrobutyrate, and so on and so forth. Now there is one, this GHB, that's gamma hydrobutyrate, they do call it rape drug because it can produce some effects that will make somebody to just pass out, causes blackout or amnesia. So some people that want to abuse the other sex, they can give them, then they pass out totally for hours. They will not even know when they are, even when they are sexually abused, they will not know. When they are raped, they will not even know who raped them, and so on and so forth. But by law, it has a very harsh penalty. When you take Schedule 1 drug, if you are caught, you are going to, it's an imprisonable offense. The health effect is it affects the brain. Then these days we have some beer, meat, and so on that people will inject with this GHB, that's gamma hydroxybutyrate. Now, at times they put it in wine to make it look harmless, but of course they are not harmless. Then we have them in different forms. At times they have some names they call them, the street names that the drug abusers call them, so that legal the people following them legally will not even know they have taken them. They can call them gamma O, Georgia homeboy, great hormones, grievous body harm. At times they call it salty water, and they call it sleep, Vita G. They have different name they call it. Now, when you are talking about classification of drug, now under this Schedule 5, 4, 3, 2, and 1, there are penalties attached. This is the one agencies like NDLEA use to prosecute drug abusers. We just watch them at times on the media, where they will say, okay, this one abused this drug, he will be sentenced to 1 year imprisonment, 2 years imprisonment. They didn't just come up with those penalties. The government already scheduled the drugs. If you are caught abusing Schedule 5, you have your penalty. Schedule 4, penalty. Schedule 3, 2, and 1, so, and so forth and so on. Now, for the next class, we are going to look at the effects and the abuse of those drugs generally. So we'll meet tomorrow for the next aspect of this topic.